couple definitions before we get started too far is biological hazard or biohazard is any viable infectious agent that presents a risk or potential risk to the well-being of humans. Biological agents are living things or substances produced by living things that can cause illness or disease in humans. And then bloodborne pathogens are pathogenic microorganisms that are present in human blood and can cause disease in humans. These pathogens include, but are not limited to, hepatitis B virus, HBV, and human immunodeficiency virus, HIV. The way in which biohazards can enter our system in order of most common ways that they can get in is inhalation, by breathing it in, ingestion, and absorption through the skin. Also, for your test, they can also enter your system through, they're included in those previous three, but they can also enter your system through open cuts, skin abrasions, dermatitis, and mucous membranes. Basically, if it's open, you have to be aware that potential biohazard may enter your system. Two basic kinds of transmission. Direct transmission takes place when there is physical contact between an infected and a non-infected person, actually touching. Indirect transmission takes place when infectious agents attach themselves to materials or objects, or also when an insect or air transmits the infection, such as malaria, for example. Even though it's transmitted by mosquitoes, it gets into your blood, it's a bloodborne pathogen. We're going to talk about several different particular bloodborne pathogens and biohazards. First of all is HIV and AIDS. I am indebted to Paul Marshall for his previous work. I totally stole this graphic from his PowerPoint from the last time this presentation was recorded. HIV is human immunodeficiency virus, and AIDS, the disease that follows HIV, is acquired immune deficiency syndrome. HIV is transmitted from an infected person by bodily fluids such as blood, urine, semen, or other blood-containing secretions. Even though HIV may be treated with antiretroviral therapy, there is no cure for HIV or AIDS, so you don't want to get it. Human immunodeficiency virus is thought to be the cause of AIDS, and the way it works is by invading helper T cells, HIV weakens the immune system and leaves the infected person open to deadly infections. The viruses gain access to a T cell by attacking the CD4 proteins on the outer surface of the cell membrane. And as it progresses, it can develop to full-blown AIDS. Treatments nowadays can hold off that process for quite a while. The biggest example in my mind is Magic Johnson was diagnosed with HIV way back in '92 or something like that, and he has yet to develop full-blown AIDS. So treatment is improving, but it is still incurable. Some statistics about HIV. More than 1 million people in the US are living with HIV, and it is estimated that 53,600 people become infected with HIV each year in the US. More than 17,000 people each year still die from AIDS in the United States. Moving on to hepatitis, A, B, and C. Hepatitis is an infectious liver disease caused by virus. Hepatitis simply means liver disease. And there's very different kinds, and many of them are, and they're not related to each other for the most part. There are A, B, C, D, also known as Delta, or hepatitis E. Some have no long-term effect, and some can be fatal. First up is hepatitis A virus, or HAV. It was first identified in 1973. It is classified as, I'm not even going to try to do those names, whatever. Okay, coronavirus. It is a single-stranded RNA virus. Some possible symptoms of hepatitis A include tiredness, loss of appetite, fever, stomachache, diarrhea, dark urine, light-colored stools, jaundice, that is yellow skin and eyes. Basically, you really, really don't want to get it. Now, not everyone who has the virus displays symptoms. It is more likely that the younger you are, the more likely you will display the symptoms. The hepatitis A vaccine, there is a vaccine for hepatitis A. It is usually given as 2 shots over a 6 to 18-month period, and it's approved for persons over 1 year of age. They will probably last at least 20 years. I found varying estimates as to how long they last, but 20 to 25 was the average. Check with your doctor about getting vaccinated. I know I had to get it when I traveled, and I think a lot of people get it in school nowadays. I'm not sure. I don't know. And interestingly, in the last 5 years, they've found that even after exposure to hepatitis A, you can still, if it get the vaccine, and it can still be effective even after exposure, as long as it's done quickly after the exposure. Other ways besides the vaccine, immune globulin can also be used before or after, within 2 weeks of HIV exposure. Basically, the thing I'm going to say over and over and over again is wash your hands, wash your hands, wash your hands. That is the single biggest way to prevent any of the things we're going to talk about. Wash your hands. Wash your hands after using the toilet or changing a diaper and before preparing or eating food. Wear gloves if you have to clean surfaces contaminated with stool, i.e. diaper changing tables, or for us custodians, just about anything in the bathroom. Moving on to hepatitis B. It was first recognized in the 1960s. It is classified as why do I even try? It is different from hepatitis A in that it is DNA, not an RNA virus. Hepatitis B is 100 times more infectious than HIV. This is bad news. About 5% of Americans have been infected with HBV at some point during their lifetime. One of the things that can also happen is people who get infected with HBV can also get infected with hepatitis D or Delta. Having both of them is extremely dangerous. One of the things about HBV is that whereas hepatitis A only presents acutely, and that is you get it, you get rid of it, it either kills you or you're done with it. HBV can also be chronic. You can have to live with it your whole life. Approximately 1.25 million people living in the United States have chronic HBV. Let's see. You can read some of those statistics. Chronic infection is much more likely the younger the person is when they're infected. As you can see, around 5% of people infected after the age of 5 develop chronic HBV, hepatitis B, sorry. HBV is found in the blood and body fluids, for example, semen, vaginal fluids of an infected person. Average incubation period is about 16 weeks from the time of exposure and the development of symptoms. HPV spreads through sexual contact with an infected person without using a condom. Injection drug use, that is using contaminated needles or syringes. Also contaminated tools in getting a tattoo or a body piercing can transmit the disease. It can be transmitted from an infected mother to her child at birth. Also through sharing personal care items such as toothbrushes or razors, or from a human bite. That would be a terrible way to get that. Possible HPV symptoms are basically the same as HIV. Tiredness, loss of appetite, fever, diarrhea, dark urine, light-colored stools, and jaundice. Once again, people who have acquired hepatitis B may not necessarily have all of these symptoms. There is a vaccine for hepatitis B. It's usually given as three shots over a 4 to 6 month period, and there's also a 2-shot schedule for younger people. Their protection will last at least 15 years. It is recommended for all infants, all children and adolescents, and adults at increased risk. One of the things that's important for us to know is that working here at DTS, you have the option of getting a hepatitis B vaccine, and the seminary will pay for it. Either that or you have to sign a waiver that you don't want it. I believe that's on your quiz as well. Ways to prevent HBV infection other than the vaccine: practice safe sex, wear gloves if you have to touch anyone's blood, don't do drugs, especially with unclean instruments, don't share toothbrush, razors, or other personal care items. Once again, tattoo or body piercing. Or if you are pregnant, you should get a blood test for hepatitis B so that steps can be taken to protect your baby if you are infected. Although I don't really see anybody that's going to be getting pregnant in this room right now. There is no treatment for acute new infection hepatitis B. However, there is antiviral medications available for chronic hepatitis B. They are not as effective as you would like if you had the disease, so it's better not to be exposed. Eventually, people with hepatitis B may require a liver transplant. Moving on to hepatitis C. It was first identified in 1989. It's another RNA virus. Approximately 3.2 million Americans are infected with hepatitis C. 12,000 Americans die from HCV-related illness each year. Chronic liver disease caused by HCV is the #1 reason for liver transplants in the U.S. It's found in the blood and body fluids of an infected person. The average incubation period is 7 to 9 weeks. Again, it can spread through drug use with unclean instruments, sex with an HIV-infected person, sharing items that might have blood on them, contaminated tools and tattooing and body piercing, or from an HIV-infected mother to her child at birth. Possible symptoms, also basically the same for all the hepatitises. It's just a matter of degree. Tiredness, loss of appetite, fever, stomach, diarrhea, dark urine, light-colored stools, and jaundice. Preventable with safe sex, wear gloves if you have to touch anyone's blood. That's the two big things. Wear gloves, wash your hands. Don't do drugs. Don't share toothbrushes. If you're going to get a tattoo or body piercing, go somewhere that is going to use sterile equipment. There is no treatment for acute hepatitis C. For chronic hepatitis C, antiviral medications are available. But only about 50% of patients get rid of the virus. Again, someone might need a liver transplant if the disease progresses. If you want more information about hepatitis, you can go to the CDC's website. Actually, for any of these things, you can go to the CDC's website and get way more information than you ever would want or need, but it's there. Hepatitis A, going back, we're going to do a quick review. Transmitted by contact with infected feces or contaminated water. There's no chronic or long-term damage. It is usually not fatal. Prevention is mainly by immunization and proper PPE. What is PPE? Basically, wear your gloves. There were 21,000 new Hep A infections in the US in 2009. The risk to our staff is minimal, but you still want to be aware of it and use proper PPE and proper procedures when coming into contact with blood or other bodily fluids. Hepatitis B is transmitted through blood and bodily fluids, i.e. semen, saliva, feces, vomit, etc. It is much more infectious than HIV. It can have chronic long-term effects, and if you do get it, it probably will kill you. If you do have it chronically, sorry. Once again, prevention is through immunization and proper PPE. Again, you can get a Hep B vaccine through the seminary. There were 38,000 new Hep B infections in the United States in 2009. There's a slightly larger risk to FBO staff for Hep B than there is for the other hepatitis. For the purpose of your test, the ones that are most likely to be exposed to at work are hepatitis B and HIV. These tests were not necessarily written with a seminary in mind, but in most workplaces, those would be the two biggest threats. Hepatitis C is transmitted through bodily fluids. It's mostly chronic long-term effects. There's a cure, but once again, it's only 50% effective. There were 16,000 new cases of hepatitis C in 2009. It's very interesting, as I was updating some of the PowerPoints, the information even as of 6 years ago, the number of new cases of these hepatitis is almost halved from what it was. So people are getting more educated about these diseases and taking proper steps to avoid transmitting them. So, and more people are getting immunized as well.
Ken?
Yeah.
Do you know if isn't hepatitis A vaccine now required for younger children?
I don't know because I don't have little kids and I don't, yeah.
It's required for grades kindergarten through 12th grade.
Okay.
And college.
I just heard that.
I got it because I traveled and I was homeschooled, so I didn't get necessarily all of my immunizations at the right time. I did get them eventually. Moving on, anthrax was part of this graphic, but we're not really going to hit it because it's not really a threat at all. Several years ago, there was the thought that maybe the seminary might be considered a target for a potential biological attack. Anyway, that's why that's up there.
That was the post office.
Moving on to tuberculosis. Tuberculosis is transmitted through the air from exposure to cough, sneezes, or other tiny droplets coming from the lungs of an infected person. It can be treated very effectively through a combination of pills. Prevention includes yearly testing. I'm sure you've all gotten those little bubble in your skin tests. And general awareness of the disease and potential exposure. Another biohazard that's actually maybe a little more potentially dangerous for us, maybe not, probably not, is molds, because we have old buildings and lots of water this time of year. But the presence of mold does not always mean a health problem. So it's important to not freak out if you do see mold. It needs to be dealt with, but it may not necessarily be a health hazard. Molds produce mycotoxins, which are toxic to humans and can, over time, wear down the immune system to produce allergic or respiratory problems. Some of these can be very severe. Prevention involves keeping moisture from remaining in buildings. That's why we do as best we can to clean up any leaks or other spills as quickly as possible to avoid the growth of mold, and also to periodically inspect facilities. If it is discovered, it should be dealt with immediately. The one that is much greater threat than any of those to us is the common cold. There are actually several viruses that cause the common cold, but they're transmitted by getting into the nose where it infects the membranes. If not properly treated, it can directly cause laryngitis, tracheitis, bronchitis, sinusitis, or pneumonitis. It is not fatal, but it severely affects performance and absenteeism. It's one of the largest cause of lost work days. There are 61 million cases of the common cold a year in the US, and a person can have an average of 4 colds a year. You're probably gonna get it. Maybe some people in this room have one, I don't know. If you get a cold, deal with it. Maybe stay home a day. Try not to get the rest of us sick. Biggest thing about prevention is washing your hands. Wash your hands, wash your hands. Covering your mouth when coughing or sneezing. Cough into your elbow to avoid transmitting it to your hands. Wipe your nose using disposable tissues. Avoid rubbing your eyes. Healthy diet and sufficient sleep are very much helpful in preventing the common cold. I think I had a run of 6 semesters in a row between college and seminary where I got a cold right after finals because I was so worn down. There is a high risk to FBO staff, so we want to be aware. We want to wash our hands. We want to use proper PPE. Use our gloves.
Take plenty of naps.
Yeah, just not at work. I had one other thought, but it left. Basic preventative measures for all of these potential hazards, and most of these things are actually on your test. So, biggest thing is to be aware of potential exposure. You want to be aware of your surroundings. Know if you're encountering blood or other bodily fluids, or if people around you are sick, and take steps to minimize your exposure. You should treat any bodily fluids that you come into contact with as if they are infectious and avoid direct skin contact with them. You should use proper PPE if touching anything that could contain bodily fluids. That includes non-absorbent gloves, such as latex, or the gloves that the custodians use. If necessary, eye protection. Remember, even treating a skinned knee could expose you to bloodborne pathogens, so wear gloves. If you're coming into any contact with blood or other bodily fluids, once again, wash your hands thoroughly and often. I think in most of our bathrooms, there's even instructions on how to wash your hands properly. There's also lots of places on campus that have antibacterial stuff. You can use that. If you do have any blood-covered items, they need to be properly disposed of. We have a biohazardous materials bin that's back there by the recycle compactor. Basically, if you have anything like that, you should contact custodial. Let's see, blah, blah, blah. Yeah, what's your question?
Thank you. Does that count for like pads and tampons as well?
No. Those, we have our wax bags that we use those to dispose of those.
Okay.
So, but if it's elsewhere, sorry, that I could have been a little more clear on that. We want to use any disinfectants that are labeled to kill some of these. I think ours, I don't remember exactly what they're labeled specifically, but a disinfectant that claims to deal with TB can be used to clean an area with suspected HBV or HIV contamination. That's on your test too. The disinfectants we use do, when they're used properly, do deal with these. If we do have a medical emergency or an accident occurs, in a medical emergency, call for trained medical assistance first, and the way for us to do that is to dial campus police. 3590 is the extension, rather than calling 911 if it's necessary, because when 911 shows up, they show up to the front of Davidson, and that does nobody any good if they can't find the person. So we want to direct them to campus police. If you are in a position where you can offer assistance and you have training to do so, limit your exposure by using proper barriers, such as gloves specifically. Even after something occurs where you clean up something like that, make sure you wash your hands even if you did wear gloves. Because there are ways to take off gloves that you don't expose yourself, but most of us aren't that careful. So we need to both be careful and wash our hands. Once again, properly disposed of any blood-covered items in containers that are labeled for disposal of biohazardous material. I guess as part of that too, we also have a couple smaller containers on campus, specifically for disposing of sharps, such as needles or other things that might have blood on them. If you do feel that you have been exposed to bloodborne pathogens during a workplace accident, report the incident to your supervisor immediately, so that you can get checked out and not have any of these things happen to you if we can avoid it.